We go now to our reporter, Laura Windsor, who has information on plastic surgery.
Plastic surgery and cosmetic surgery treatments require educated and artistic decision-making. Where do you go and what credentials do you look for when making such an important decision? We spoke with Dr. Thomas McHugh and asked him what someone should look for in a plastic surgeon.
First, looking at someone's credentials, looking if they board certified within their specialty. A lot of times recommendations from previous patients or family, friends does real well, or even from the medical society or from even the state board does real well. In plastic surgery, we're very regulated, so even our national organizations like the American Society of Plastic Surgeons is a good organization to look into the credentials for any plastic surgeon. In the New England Journal of Medicine, there was a recent article that showed that people's outcome for surgery is directly proportional to the experience of their surgeon. The doctor has to look and to say, this is what we can and we can't do. A lot of that is experience, but a lot of it is looking and having that artistic eye of just saying, okay, this is going to look a little bit better through here. This curve through here is going to look a whole lot better. So we all see images of plastic surgery that's gone wrong, and it's usually plastic surgery that's overdone. Most people want to look like they had something done, and they don't want to look like they had it done. So it's that dichotomy of, I want to look good, but I don't want anybody to know. People have that image of what they want to look like, and a lot of times it's about 10 years younger or so from where they're at. But again, it's always to have someone look good for their age, and also to get the outcome that they're trying to find.
Dr. McHugh, what is the most common comment or reaction you get from a patient after they see the results of their surgery?
Well, most patients, when they have plastic surgery, are very appreciative of what they had done. But they had this image. They had this image of what they wanted to look like. And you're trying to meet their goals. That's why it's very important when we talk to the patient ahead of time, see what their realistic goal is. Because if they have some sort of goal of how they want to look and we can't meet that, then they're going to have a very disappointed patient. So it's trying to see the image that they want to see and trying to have that reflected after the surgery.
We asked Dr. McHugh, how has plastic surgery evolved with modern technology?
Plastic surgery has tried to keep up with modern technology and with lasers or sound waves or different things that we can use, different techniques, different methods of energy that we can use to get the best outcome. Typically, like liposuction. Liposuction really came on the forefront about 20 years ago. But since that time, we've used things with lasers to help with tightening the skin, not just accepting removing the fat, but trying to get the best outcome. So we treat patients with sound waves to help tighten skin, get fat that we couldn't get out before, lasers to help tighten the skin. Again, using natural substances to get the best and most natural look.
We asked Dr. McHugh about the future of plastic surgery.
In the future, plastic surgery is not all just about the looks. It's about the person's total well-being. They want to feel as good as they look. So in assisting them, like in our office, we try and give them the best outcome by treating both their inside, so to speak, and their outside. The inside for wellness, detoxification, exercising, all the things that go together with having to look on the outside. Too many people feel they look so good on the outside, but they're still not feeling the best. And that's what we're trying to do, make them feel good all over.
Dr. McHugh, how satisfying is it for a plastic surgeon to see the outcome of a patient who is happy with the results of their surgery?
Changing people's lives or having them come back with a hug or whatever, it's just one of those things that, you know, I'm getting paid for this, but it's just the people's satisfaction and just having someone feel good about themselves when they were really down. You can see such a dramatic change. I mean, just one quick example of that, sometimes we'll see the teenager comes in with her hair all down and her ears stick out, and she's going to be a cheerleader. And you kind of, you know, and she goes, what am I going to do? You fix her ears, she comes back, she smiles, hair's all pulled back. It's just wonderful.
Choosing a plastic surgeon is a very important and personal decision. If you are planning on a cosmetic procedure, make sure you find the right surgeon for you. I'll be back later in this program for a look at peripheral artery disease. For the American Health Journal, I'm Laura Windsor.